And I spoke to Dr. Shyama Kuruvilla, director of the WHO Global Traditional Medicine Center.
So for billions of people around the world, they're already using different forms of traditional medicine, either because it's their primary access to healthcare, but for many in low, high, middle-income countries, it's also a preferred choice for more personalized, holistic, nature-aligned solutions, and something that's more personalized. And so WHO's role is very clear. It's about assessing the evidence base, especially on efficacy and safety, and ensuring that people have the highest quality care for their health and well-being, and with traditional medicine, because it's so aligned with nature, it's also for the health and well-being of the planet we share.
Can you tell me about how China is working with the WHO on traditional medicine?
So China has been a long-standing partner with WHO, and China has been working with WHO to support the documentation of traditional Chinese medicine, to ensure that there are global standardized codes to collect data, for example, on the International Classification of Diseases, and also on the International Classification of Health Interventions. It's also really important for practitioners. As you may know, acupuncture is probably one of the most widely practiced traditional medicine interventions around the world globally. And so having standardized practice and training and education approaches also is very important. And this knowledge is millennia old in China and continues to use today and is evolving with the science. And I think China's close engagement with WHO and the complementarity of those roles has been very important.
What developments have there been in researching the effectiveness of TCM, and what are the challenges?
So there's been real progress on researching the effectiveness, and there have been, as you know, historically several challenges. Our predominant way of establishing effectiveness has been more aligned around the biomedical pharmaceuticals, where you might have a single molecule or active ingredient, and then you're looking at its effect on a single symptom. Whereas traditional medicine systems are looking at more holistic, personalized, context-specific applications, which actually is where the world is moving to now with precision medicine and preventative and personalized medicine.
And what work still needs to be done?
The work around strengthening the evidence base, both in terms of developing fit-for-purpose criteria to establish safety and efficacy using frontier science technologies that are now enabling us to do this, would be the first step. WHO has just conducted a global research priority setting exercise, and we found that less than 1% of global health research funding is going to traditional medicine, even though it's used by billions of people and there are so many applications. So the funding of research as well and the prioritization is really important. That then informs regulation to ensure that it's safe and effective use, as well as equitable access. And that leads us to the integration agenda, and then the cross-sectoral value, because the global wellness industry is one of the most rapid growing industries worldwide, and traditional medicine is at the heart of it.